Welcome to our very special show, Health and Wellness, Myths and Facts. I'm Ambika Singh Kama. As of now, we know that Omicron is a less severe variant of the COVID-19 virus. In spite of that, people are getting hospitalized, though their numbers are less compared to the second wave of COVID-19. It is visible that vulnerable people, like those with comorbidities like diabetes and heart disease, elderly people, people who have not taken both their vaccine doses, can have a severe form of COVID-19 following infection from Omicron. Obesity continues to be a significant public health crisis. The pandemic only exacerbated a problem that was already quickly accelerating in the last decade. The pandemic revealed how the growth in obesity threatens the health of both individuals and the healthcare system. Especially in India, obesity has reached epidemic proportions in the 21st century. Obesity increases the risk of several debilitating and deadly diseases, including diabetes, heart disease, and some cancers. Obesity is a disease and must be treated as one. We have an expert panel with us to discuss the problem associated with obesity and its solutions. So if you have any questions you would like to ask our experts, please send them to us via WhatsApp to the following number. The number is +91 9167 666 941. That is the number to send us your questions for our experts. Also, do please send in your name and your location. Introducing our guest today, we have with us Dr. Piyush Lodha, MD Medicine, DM Endocrinology Consultant, Endocrinologist, Ruby Hall Clinic, KEM Hospital, Pune. And we have with us Dr. E Saravanan, MD, DM Cardiology Consultant, Interventional Cardiologist, KG Hospital, Coimbatore. Thank you all so much, doctors, for joining us today. Starting with you first, Dr. Lodha, most people have started believing that Omicron is just like a common cold. So do we not need to worry about this? Is this kind of, this whole thing, is it really safe to think that it is safe and, we can take it lightly? What are your thoughts on this, about the risk factors of Omicron?
Although it's a good news that Omicron, the new COVID-19 variant, is causing a milder form of disease, but still patients who are having comorbidities like diabetes, hypertension, heart disease, or kidney disease are more prone to have a severe form of disease, its sequelae, and its long-term organ damage complications. Second aspect is metabolic perspective. What we have been observing these days is that the sugar levels in diabetes cases are worsening as bad as that in the previous wave. And also the new onset diabetes is increasing after COVID-19 infection. Okay. So this is a bit alarming. And considering these factors, it's better to follow COVID appropriate protocol. And for those who haven't got their vaccination done, to get their shots for vaccination.
Absolutely. I think still following COVID protocol is key, and of course vaccination, like you rightly said. Dr. Saravanan, if the double dose vaccination is sufficient to prevent COVID, how can a person acquire the infection 1 year after being vaccinated? This is a viewer question which has come via WhatsApp.
Vaccination prevents against severe infections and COVID deaths with an efficacy of around 99%. Whereas for infectivity, it is roughly around the mid-70s, around 75 to 80%. So a person, in spite of taking 2 doses of vaccines and 1 month after the 2 doses of vaccines, he is said to be completely immunized. His chance of getting severe COVID is very less, but still he has a 25% chance of getting infected. That is one. Vaccination does not affect the transmissibility also. So he can still transmit to another person, but he will not get severe infection or COVID deaths. Okay. Another reason is after 2 doses of vaccines, studies in the Lancet have shown that after 6 months or 9 months or so after the second dose, the immunity might wane, and hence a person might get infected. But still, the chance of getting severe infection and COVID deaths is very, very less with vaccination.
Okay, so I think that is a thing to really look at it. Vaccination is key because the severity is down. We have another question from our viewer, Dr. Lodha. The question is, with minimal medications and maximum exercise, can a person who has had diabetes for 10 years keep sugar in check? And what type of exercise do you recommend?
Yes, definitely. Lifestyle modification in the form of diet and exercise is the mainstay for treatment of any form of diabetes. Exercise will not only help in keeping your sugar under control, but it has other benefits like prevention of osteoporosis, prevention of your cardiovascular diseases, your lowering of cholesterol. So these are the various benefits of exercise. Coming to types of exercises, we basically have two types of exercises, aerobic and muscle strengthening. Aerobic exercises will include your walking, jogging, running, cycling, etc. And your muscle strengthening exercise will include your weight lifting.
Okay.
In routine practice, we do advise a mixture of the both, which should be somewhere around 150 minutes per week in divided sessions.
Okay. So
For people who are busy these days, what we advise is, I suggest my patients to divide your sessions as 10 minutes in morning, 10 minutes in afternoon, and 10 minutes at night. This will give you same amount of benefit. And two important things which I would like to highlight over here. One is patients who are having heart disease should undergo their cardiac workup before sticking to some sort of exercises, as few exercises are contraindicated in these cases.
okay.
And second most important thing is watch for hypoglycemia. It's better to get your sugars done before and after exercises, or the other way is you can have a small amount of snacks just prior exercise.
Okay, so exercising is key, and I think the tips which you've really given us, Dr. Lodha, about even I think that's a great way to think. If you don't have time, you can space it out through the day, and even what you said about how to deal with it if you're a cardiac patient or low glycemic. Moving on, Dr. Saravanan, obesity is one of the major nutrition-related disorders. Other than nutrition, what are the other factors responsible for obesity?
Yeah. So as pointed out by Dr. Lodha, the main thing is we need to understand is stress. That is a very important factor, and sedentary lifestyle. So I always tell my patients, food is not only what you consume in your stomach, it is also what you feed your mind. So our thoughts, stress is also an important factor. So sedentary lifestyle, stress, illnesses like thyroid illnesses, hormonal disorders like Cushing's syndrome, and chronic intake of medicines like steroids and antidepressants are important non-nutritional causes of obesity. So, and one more thing is, as I told, as pointed out by Dr. Lodha, physical activity, brisk walking, swimming, cycling. This is actually enough for the majority of the population. So I would say follow the talk test. Talk test means if myself and Dr. Lodha go for a walk, if I try to speak to him, I should be breathless, and if he tries to speak to me, he should be breathless. If you do this talk test and fast walking for 25 minutes a day, that is more than enough.
Okay. So that way you also can check, your stress levels. I mean, when you're talking to somebody, so talk test is an interesting way actually to do it. And of course, like you rightly said, exercising and keeping stress away. Dr. Lodha, internet is flooded with a lot of information about weight loss. What are the right methods to achieve weight loss, and how much weight loss is really safe?
Yes, for weight loss, as I noted previously, again, lifestyle modification in form of diet and exercise would be the mainstay. On internet, you'll come across many types of fancy diets which claim to cause weight loss. But before sticking to some particular diets, it's better to know the pros and cons of that diet. For the viewers today, I would like to suggest, do not practice a diet which is advised for someone else. You need to individualize your own diet plan, because a particular diet plan cannot suit you. For example, if we consider cutting down of carbohydrates completely, it may not be feasible and sustainable for long term.
Okay.
And in routine practice, what I advise to my patients is to have a balanced diet, which should include of good amount of fruits and vegetables. And you need to cut down your calories by approximately 20%, the present calories which you are consuming. This will have a good amount of metabolic benefit.
Okay. So, Dr. Saravanan, what are your views on weight loss? Because again, whether it's diabetes, whether it's heart disease, whether it's obesity, there is a lot of information. There are fad diets. There's so many things which people have been reading, like we were talking on the internet as well. So what are your thoughts on this, on the right kind of food? Because balanced diet is key to a healthy person.
Yeah, see, as pointed out by Dr. Lodha, same.
Yes.
Diet should be balanced. There are multiple diets on the internet saying paleo, keto, and so on. So, but these diets are difficult to be sustained in the long run. What I would say to my patients is, customize your diet according to your lifestyle. Take a high fiber content, high fiber in your diet, moderation of carbohydrates, because Indian diets or even the Asian diets are all high carbohydrate diets.
Yes.
So, but if you ask me, an average Korean or a Japanese takes more carbohydrate than an Indian, but still their incidence of obesity is less compared to India. That is because they have what we call non-exercise activity thermogenesis. They go by walk to the nearby salon, they go by walk to the metro to go for work. Whereas Indians, we always use two-wheeler or four-wheeler for everything. For even going to the nearby shop, we use a two-wheeler. For going somewhere even 1.5 kilometers, we use a four-wheeler or two-wheeler. So, diet along with lifestyle. What I would say my patients is, don't follow a diet, follow a lifestyle.
Absolutely.
Good fiber content, adequate walking around at least 30 minutes per day, managing your stress. These are all important things in managing and preventing cardiovascular illness.
So a healthy lifestyle, like you said, of course, eating well, eating the right things. And what I think the most important thing, what you all both said, is about sustaining any kind of diet which we follow. So on that note, we're going to be taking a really short break. We'll be right back. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we've been talking about how obesity is a health crisis. Starting with you first, Dr. Saravanan, we've understood about obesity, we've spoken about diets. Tell us, what's the difference between good and bad cholesterol, and can a person lower the risk for heart disease if he or she lowers cholesterol levels?
See, cholesterol is required for our bodies because cholesterol is a part of our cell membrane. Every cell membrane is composed of cholesterol. So that is very vital for body to function. But bad cholesterol, what happens is it gets deposited inside the blood vessels, and this leads to plaque formation. So the bad cholesterol causes narrowing of the blood vessels. If this happens in the coronary arteries, that is the blood vessels which supply the heart, it leads to heart attack. If the same cholesterol gets deposited in the blood vessels supplying the brain, they lead to stroke, what we call, common people call it brain attack. Or if this happens in any blood vessel supplying your legs or your hands, it leads to what we call peripheral arterial disease. Reducing your LDL cholesterol is shown to reduce the risk of heart attacks by around 20 to 25%.
Okay,
Whereas good cholesterol, the good cholesterol is the cholesterol which causes reverse cholesterol transport. So what it does is, it takes the cholesterol from the blood vessels and sends it back to the liver, from where it is removed from the body. So increasing your good cholesterol and lowering your bad cholesterol is essential for us to be heart healthy.
Okay, so while cholesterol is important, it's how we really manage it. We increase the good cholesterol and decrease the bad cholesterol. Thank you for explaining that. Dr. Lodha, if you have diabetes, lifestyle modification is obviously the first prescription of a doctor. Weight loss is a part of lifestyle modification. Can losing weight help to reverse type 2 diabetes?
Well, since many years, it's been known that diabetes is an incurable or irreversible disease. However, this thought is being changed now. It is possible to achieve the remission in type 2 diabetes, and this can particularly be done by weight loss and strict lifestyle management. This is particularly true in patients who are obese. As we all know, obesity is the main culprit which is leading to diabetes over a period of time. So if we cut down on weight, maybe somewhere around 5 to 7% over 3 months of time, it can lead to reversal, or the better outcome would be prevention of progression or delay of the progression of diabetes.
Okay.
And second most important thing is, people who have been recently diagnosed to have type 2 diabetes are likely to have the reversal and likely to have prevention in the progression of diabetes.
Okay.
If we prevent this progression, it's possible to decrease the complication burden, which will be seen in long-term cases of diabetes.
Okay.
And one more important thing is, even if you achieve remission, type 2 diabetes tends to reoccur. So it's better to follow the good lifestyle practices even if you have attained remission.
Yes.
And you need to continue the same lifestyle.
Yeah, lifestyle is important, and like you said, I mean, modify our diets and exercise, of course, but definitely weight loss can help reverse diabetes and help diabetes and at least avoid the complications. Dr. Saravanan, high cholesterol raises your risk for a heart attack or a stroke. But high cholesterol isn't something you can see or feel. The only way one really knows it that if you have a problem is to get a blood test. So at what age should people begin to check their cholesterol levels? Are there any symptoms which can alert a person about high cholesterol levels? Or how would one person know that they need to check their blood work done?
See, there are certain diseases called familial hypercholesterolemia. So those kind of diseases tend to occur in younger age, and those patients tend to have what you call Xanthelasma. That is nothing but cholesterol deposits around your eyebrows, or it may deposit around your legs, or what you call tendon xanthomas. So, but these can only be diagnosed by a physician, shoot physician. So what I would say is, if you have a family history of heart disease, that is if you have someone, if your father, mother, brother has had a heart illness less than the age of 55 years, I would say from the age of 30 years, get your cholesterol levels checked once in 3 years. If it is normal, get it checked once in 3 years.
Okay.
Above the age of 40 to 45 years, get your cholesterol checked once a year. It's very essential, get it checked once a year. This is for people whose cholesterol levels are normal. Those who have abnormal cholesterol levels should get it checked once in 6 months.
Okay, so that
above the age of 30, once in 3 years, above the age of 45, once in a year, and if it is abnormal, once in 6 months.
Okay. Sure, thank you for explaining that so that one can really keep a track on their cholesterol levels, which is key. Dr. Lodha, what does one really mean by the term diabesity? What causes diabesity? Is it different from normal obesity? Because this is a very new term which we've been hearing.
Yes, well, diabesity is nothing but a combination of diabetes and obesity. It is just a fancy term which is being used for the combination of the two terms. And diabesity, like obesity and diabetes has a very strong correlation. As we all know, obesity is the culprit, which leads to diabetes over a period of time and predisposes a person to develop type 2 diabetes.
Okay.
And every 1 kilogram gain in weight will cause an increased risk of diabetes in future by around 4%.
Okay.
So obesity is the main factor over here. Second is a BMI calculation can help you diagnose the obesity. It is very simple to calculate BMI based on your height and weight. A BMI more than 25 for Americans, and for Asian Indians, for our population, a BMI of more than 23 is suggestive of overweight. If you are lying somewhere above 23, you need to cut down your weight, you need to cut down your calories, you need to follow lifestyle modification, and thus you can prevent the complications which can lead from obesity.
And I think the way you've really connected it with every kg which you put on weight, it does lead or it can add to chances of diabetes. That's really well explained. So I think key here is again to lose those extra pounds. Dr. Saravanan, obesity is related to the metabolic rate. Some food items can stimulate the rate of metabolism, and also, that also helps to lose weight or weight loss. Is that true, and how can you identify such foods?
See, our basal metabolic rate is the amount of energy that is required to do basic activities like breathing, eating food, digestion, etc. Foods with high fiber content, spices like ginger, pepper, and foods like flax seeds, the caffeine in our coffee, the theobromine in our tea, all tend to increase our basal metabolic rate. But it's a very important but. The basal metabolic rate which is increased via diet is only temporary, it is only short-lived. It cannot be very sustained over the long run. Whereas over the long run, weight training, that is strengthening exercises, tends to improve your muscle mass. So more your muscle, the better your basal metabolic rate. So I would say for short term, high fiber foods, spices, these can help. Caffeine, theobromine can help. Lot of so-called energy drinks are high in caffeine and they tend to boost our metabolism only in the short term. For the long run, strength training which improves your muscle mass helps in improving your basal metabolic rate.
Okay. So thank you so much, doctors, for joining on this very special show and sharing your expertise with all our viewers. Thank you all so much.
Thank you.